Hi everyone. Hey, Dr. Adrienne Castrovinci with Healthy Living Chiropractic. I hope you guys are having a fantastic day today. It's Thursday, sun is shining, and we are going to be talking about health, okay? We're going to be focusing this month of August on family wellness care. So we're a big family wellness-based practice, and I'm going to be discussing today kind of what we do with our families, why they're some of the healthiest people that we see, and just kind of what types of things we can do in our offices and how we can help you as well. If you like what we talk about today, please feel free to like, comment, share. If you know someone that's dealing with some unhealthy issues with their children, please share this information. We'd love to kind of spread the word about nutrition, about health, about wellness, and we can answer whatever questions people may have. So let's get started. So unfortunately, kids are sicker now than they pretty much have ever been. 1 in 6 have a chronic illness being allergies, asthma, eczema, problems with depression, anxiety, autism. The rates of autism are now 1 in every 33 children are diagnosed with autism. It's insane. Our kids are so unhealthy, and actually the children that are born after the year 2000 have a lower life expectancy than their parents. So our life expectancy is starting to go down, and our next generation of kids is not healthy. They're on a lot of medications. There's a lot of reasons for that, and we're going to kind of talk about that today. And we're going to discuss again kind of what types of things we can do to help. So despite the United States having extremely high income levels, we have 3 times the infant mortality rate than any other developed country. That is staggering. We have amazing medical care in our country, yet so many more babies are dying. 3 times the number of babies are dying on the first week of life than any other country, and that just disturbs me so much. Kids today are taking so many medications, and research has been showing that taking more meds does not lead to increased health. Taking more meds, especially for kids, leads to decreased quality of life and decreased health. So overprescribing medications is setting children up for a downward spiral of increasing side effects and worsening health outcomes, because what these medications are doing oftentimes are not addressing the root cause of the problem. They're dealing with symptoms. So from 2006 to 2015, prescriptions for ADHD medications among ages 2 to 24 increased from 4.8% to 8.4%, so they're doubling. And also these kids, unfortunately, are now taking more than one medication. So they say 25% of kids were taking only one medication before. Now up to 40% of kids are now taking more than one medication. So we're talking about a double-fold increase of the number of medications that kids are taking. The biggest thing too is that these children are taking, from really, really young ages, they're taking psychiatric medications. They're taking medications for musculoskeletal pain. And as a chiropractor, we do a lot with musculoskeletal pain. So if kids are taking painkillers and opioids, that's a huge, huge problem. We don't want to have that. We want to find ways to help our kids deal with musculoskeletal issues naturally. And that's what it is that we do. The biggest thing too, as I was researching this and looking at some stats, is that children as low as 1 year old, so birth to 1 year, are taking anti-anxiety medications, antidepressants, ADHD medications. These are babies. And so that just really kind of hurts my heart and hurts my soul, because I know that these kinds of medications they're not thriving with them. We've got to figure out ways that we can help them naturally so that they can grow and do what they're supposed to do. So what is it that we can do about this? You know, these numbers and these stats really bother me. So my goal is to really do what I can to help families, help kids to be healthier. So the number one thing that we do in our office is we educate. We educate on natural health. Our society is meds, meds, meds. Let's take drugs. Let's do this. Let's kill this symptom. Let's hide this symptom. The big thing we do is we look for the cause. What is the reason why the kid is having anxiety issues? What is the reason why the person has behavioral issues? A lot of times, kids who have behavioral issues, they are not eating properly. They have poor gut health. If you have poor gut health, that leads to poor brain health. If kids have had a lot of antibiotics in their early years, that's gonna mess up the gut microbiome, which is kind of the terrain of the gut, if you will. If we mess up the gut microbiome, kill a lot of the healthy bacteria, it becomes sick. It becomes overridden by unhealthy things, which then affects the brain in a negative way. There is a huge gut-brain connection, and there's a ton of research on it. I'm not going to kind of get into it today, but if the gut is unhealthy, the brain is unhealthy. So the number one thing we do, like I said, is educate. We talk about ways to eat healthy. We talk about certain foods such as gluten and dairy are big triggers for kids that have attention deficit disorder. Artificial colors, artificial foods, artificial sweeteners. We've talked about those in the past too. Those are neurotoxins. Fluoride is a neurotoxin. A lot of these things, once they're eliminated in the body or brought down, especially in the child's life, they can start to feel better. We can also do some we can do some QNT testing, quantum nutrition testing, and do some detoxification to help them to clear these issues so that their bodies can heal properly from the inside. And when you heal from the inside, you no longer display these activities or these emotions as much, negative ones especially, if you will, from the outside. So looking at the body from the inside. So let's start kind of with pregnant women. I mean, really, I am a pregnant mom specialist. That's one of my favorite populations to work with, are the pregnant moms. We get them on a really good, healthy prenatal vitamin. We get their body adjusted. We help to keep their emotional and physical stressors down while they're pregnant. We can talk about healthy nutrition. All of those tie into a good, healthy baby. So we really start with pregnancy. After the baby's born, then we do no fee infant checks for my pregnant moms that I work on. And checking an infant and a newborn is one of my favorite things to do, because they oftentimes will have some issues. Usually C1, way up top by the ear, is a little off with a newborn, because after they're born, pulling on the head and twisting and turning can cause them some issues. So we adjust them, we help them to feel more comfortable. Oftentimes babies that are not checked by a chiropractor can potentially have a tongue tie that's left, that maybe the pediatrician doesn't recognize. That baby isn't nursing properly, can get a little too much air inside their mouth as they're eating, can then cause gassiness, and then is now acid reflux. So then a baby's thrown on Prilosec or Zantac, which is now proven to cause cancer. So they're giving these tiny babies these medications because they have a tongue tie. Not all of them, but some of them, because their nervous system is tight, or their spine is tight. We can gently relax them, help their bodies to calm so that they can function a bit better and feel better and no longer have that gassiness. I see it all the time. Babies with colic, babies that have problems sleeping, problems soothing, problems with constipation. You'd be surprised at how many children, toddlers, and babies are on Miralax. And Miralax is just an irritant, essentially, in the GI system. It doesn't fix the problem. We adjust the spine, usually in the mid to the lower part of the back, and they start pooping right away, which is fantastic. As kids get into toddlers, problems with crawling, walking, standing, talking. If a kid is crawling and kind of hiking their leg up a little bit, that's an indicator there's something wrong with their hips and their SI joints. That is something we can address. The proper cross crawl, if it's not done with that opposite arm, opposite leg motion, it can definitely cause some other neurological issues with them. So we want to get those addressed really quickly. Kids that are not walking well or have low tone can definitely benefit from a chiropractic adjustment. And mind you, chiropractic adjustments with little kids are extremely safe and they're extremely gentle. I use an activator for some kids, usually in the hips and low back, but I'll use a headpiece, a pediatric headpiece. I've also made a couple of videos on this. You guys can look back and see, but this little headpiece comes like this. Put the baby's head or child's head on here. Does a little mini drop. I put this around my neck and put the baby's head here. And the kids actually respond really well. They think it's kind of fun. And there's no twisting, there's no force. We don't use any like forceful techniques with little kids. So it's all extremely gentle. But we can help a number of toddlers kind of connect the brain to the body and be able to kind of function better. And like I said, everything is very, very natural. As kids get a little older, oftentimes we'll see musculoskeletal issues. I had a 4-year-old that came in yesterday who was complaining of neck pain. She wasn't eating at daycare. Her mom had to go pick her up. We adjusted her. I found a an issue up here on her upper cervical spine. I adjusted her, and her mom sent me a message later on saying that she's a totally different kid because her neck hurt, and kids can't necessarily articulate well that they hurt, and that can definitely affect them. All right. Food sensitivities, ear infections. We talk a lot, like I said, education. We talk a lot about natural remedies for things. That's one of my specialties. I have 2 children. They're 10 and 12, and we've done all of the things for them throughout their lives. And I know a lot of really great remedies to deal with if kids are sick. We don't always need to jump to the medications right off the bat. There's lots of things you can do ahead of time. So we talk about those in our office. When we've got families under care, we discuss these kinds of things. Supplements, and we'll talk about those here in a few minutes. Posture, sports injuries. If I'm an athletic trainer or was in college, so if you've got a kid that's had a sports injury that isn't quite emergency status, have them check with me. I can always evaluate and check and see what it is we can do. If we need to refer out, we will. So I can always be a kind of a triage, if you will, not at the high price point of an urgent care visit. With teens, scoliosis, we've talked about that in the past, anxiety, depression, a lot of this stuff ties into gut health. So like I said before, brain health and gut health are closely interwoven. So if you've got a teenager that's dealing with a lot of health, anxiety, depression, those types of issues, let's look at their diet. Let's look at some supplements. Let's look at their toxic level before you start throwing them on a medication, because there's so many side effects that can be very detrimental to children. Let's talk about some things naturally. I'd love to be that resource for you. So just kind of in summary, we have a ton of families under our care. I've had families where I've seen the woman before she got married, she gets married, she gets pregnant. They've then had 3 or 4 children. I've worked on her throughout, and multiple families like this. But I work on the mom with each individual pregnancy. They have great childbirths. The kids are all super healthy. Yes, kids get sick, but the kids that are under my care and that I see once a month, once every couple of weeks, are honestly some of the healthiest kids that I know. Chiropractic care is so beneficial, and I know that it's not always talked about in our society, so I really want to share this with you guys, that if you know children that are sick a lot, if you've got a grandchild that, God, that kid is sick all the time, that is the kind of person that I would love to talk to. If you know a baby that has just been struggling with unable to soothe or having a hard time, and kids that are on the autism spectrum, kids are dealing with ADD, ADHD, any of the things that I mentioned in the beginning, I would love to have a conversation with them to see what types of natural types of things we can do. Oftentimes chiropractic care, kind of connecting the brain with the body via the spinal cord, is so beneficial to turn that nervous system on a little bit, or to calm it down in some places if they're over hyper. I've seen all of those things happen. So today, like I said, I just love the opportunity to work with you, work with someone that you know that's dealing with health issues with their child. So just finishing up, we are offering a pretty awesome special this month from now through the end of August. We're doing family new patient visits. So basically you just need 1 adult and at least 1 child, and we're doing the whole family for $99 for an initial evaluation for chiropractic care. So that's $99 for the whole family. So you've got a family of 5, we're gonna see all 5 of you for $99. So if you could share this information with someone that you know, I would love to connect with them. We can offer a free phone call consultation to discuss if this is right for them. So I hope everyone has a great day. I hope your kids stay healthy, and I hope you have a fantastic Thursday.